Hello, this is Congressman Phil GIngrey, and welcome to This Week in Washington with Congressman Phil GIngrey. The debate on health care reform continues to rage on. Unfortunately, the Democratic majority and President Obama continue to insist that we spend $1.5 trillion to totally reform our health care system and to let the federal government eventually take it over. That's what this debate about a so-called public option, a robust public option, is all about. Unfortunately, in doing that, the $1.5 trillion it's going to take of new expenditures is coming on the backs of small business men and women in this country by way of an additional $600 billion worth of taxes. Even the president's chief economic advisor, Christina Roma, says that's going to cost an additional 5.7 million lost jobs at a time when the unemployment rate now is approaching 10%, and we've lost over 3 million jobs just since this past February. The Democrats continue to say that their plan is the only plan because the Republicans don't have any alternatives. My constituents, I want you to look right here on this table. I haven't counted them all, but I would say there are 15 Republican bills submitted by an equal number of different Republicans in the House of Representatives. Some of them are individual bills like medical liability reform. Some of them deal with medical records. Some of them deal with allowing people to form high-risk pools. Some of them deal with equalizing the tax treatment, so an individual would get just the same tax break if they went out and purchased their own health insurance as these employees get from a large employer. I could go on and on and on, but here they are. And yet the White House and President Obama continues to say the Republicans don't have any ideas. Even more important might be this little card that I want you to take a close look at. This is another bill, H.R. 3700. We call it the Health Care Bill of Rights. Where did it come from? It came from those town hall meetings that we all attended during the month of August, where thousands of people, grassroots folks, a lot of senior citizens showed up and said, look, Congressman, this is what we want. And so we put it in the form of a 2-page bill. We call it, as I say, H.R. 3700, the Health Care Bill of Rights. And look, 10 principles or prescriptions, 10 prescriptions for a healthy America. We heard what the president said, so look, here they are. No government-run health plan, no cuts to seniors' care, no taking money away from our current Medicare system to pay for something else, no new deficit spending, the president promised us that, no new taxes, no ration of care. Nobody, especially our seniors, want to get thrown under the bus when there are not enough doctors and there's not enough money to go around. No individual or employer mandates. We don't want to be forced to do anything in this country. And certainly no taxpayer-funded coverage for illegal immigrants. And finally, we agree that insurance companies should not deny coverage to people just simply because they have pre-existing conditions. And we agree with the president. We need medical liability reform. The Congressional Budget Office indeed has said that that will save $43 billion over 10 years. I think, in fact, as a practicing physician for 26 years, I know it will save a whole lot more than that. But last but not least, anything that we do, and it doesn't have to be a 1,500-page bill that's coming out of the Senate or a 1,300-page bill coming out of the House of Representatives, any bill we pass should lower the cost of health care. Make it more accessible, make it more portable, not raise the cost. And that's what these current bills do. I will continue to fight for you and to make sure that we pass something sensible like H.R. 3700, Health Care Bill of Rights, 10 prescriptions for a healthy America. Stay tuned, and thank you so much for listening.